Hello, and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us once again. We'll be speaking with Dr. William Dale, Director of the Center for Cancer and Aging and Vice Chair for Academic Affairs in the Department of Supportive Care Medicine at City of Hope. He's joining us to discuss the updated Cancer and Aging Guidelines released by the American Society of Clinical Oncology. Welcome to Health Professional Radio, Dr. William Dale. Thank you so much for taking the time this evening.
Thank you very much. I'm happy to be here. Thanks for having me.
What is your area of expertise? Tell us a little bit about yourself and your role at City of Hope.
Sure. I'm trained as an internal medicine doctor with fellowship training in geriatrics, taking care of people over the age of 65, and supportive care medicine or palliative and hospice care. That's my clinical expertise, and I take care of older patients with cancer here at City of Hope. I'm also Ph.D. trained in health policy and serve as the Vice Chair for Academic Affairs in the Department of Supportive Care Medicine, kind of bringing together both health policy, supportive care medicine, and cancer and aging.
In taking care of older adults, it's my understanding that patients 66 years or older make up over half of those diagnosed with cancer. What is a geriatric assessment, and why is it needed? Is this something that is brand new, or has it been going on for a while and simply possibly overlooked by some professionals?
Right. So that's right. Patients over the age of 65 or 66 and above are somewhere between 50 to 60% of all cancer patients, depends on which cancer you're talking about. The geriatric assessment is a multidimensional, multidisciplinary assessment of a person's overall health and fitness, and includes essential domains that are important to older adults, including mobility, their daily functioning, nutrition, social support, mental health, comorbidities, and cognitive affairs. Mm-hmm. And you sort of asked, is this new or has this been around? And in some version, it's been around for quite a while, especially in areas of geriatrics outside cancer care. More recently, a group of people, including me, have been developing formalized ways of assessing these dimensions and putting them together into this new tool called a geriatric assessment and studying it.
The American Society of Clinical Oncology recently released an update to its 2018 Cancer and Aging Guidelines.
And also a little bit of a bridge between the development of these tools, this geriatric assessment, and what the new sort of guidelines are and why they came about now. So we have these assessments in this multidisciplinary way because we kind of need them to assess things like how fit the patients are, to give us prognostic information, so information about how they're going to do with and without treatments. They help us target interventions. So if you have a problem with your mobility, you might need to see a physical therapist, for example. And then it helps us communicate and make decision choices for patients who might be older and are facing this decision of making choices about their cancer care. And then ASCO, or the American Society of Clinical Oncology, recently decided, based on a couple of new studies that we did, showing the benefits of this geriatric assessment, which were primarily to reduce chemotherapy toxicity in older adults. These are in large randomized trials in two large studies published in Lancet and JAMA Oncology, and without compromising survival. So we improved quality of life without affecting length of life. So the new guidelines really say the evidence is so strong that any patient over 65 really needs to have these geriatric assessments. Mm-hmm. And the updates from the prior guidelines in 2018 are extending what was only for chemotherapy patients to any systemic therapies, including things like immunotherapies or hormonal therapies. And then that the interventions we now have, which are largely based on supportive care, so they're supportive care interventions based on the geriatric assessment, we now have good evidence that they have impacts that matter. So those are the big updates from 2018 till now, is now we really effectively can do this, and the strength of the recommendation is stronger and broader.
Are these assessments widely known among physicians? Are they even aware that this new tool exists?
It's a really great question. So the answer is they aren't as well known as they probably should be, based on the strength of this evidence. So we and some others have sort of started to ask oncology practitioners, are you aware of these guidelines? Do you use them in your practice? And we find that relatively small percentages of people, on the order of 15 to 25%, say they use these tools regularly. And so we also know from these surveys that when they're aware of them, they're 2 to 4 times more likely to do the things we recommend they do. So we think the guidelines have impact, but we also think not enough people know about them.
For someone listening to this program right now, how would they start the conversation of GA if their practitioner doesn't bring it up?
Yeah, that's a great point. It was actually going to be one I brought up, is the patients have a lot of impact in this. And so if you're seeing your oncologist, you can say, I've been wondering, I'm kind of, concerned about how this treatment fits into me and my life. And I'm wondering, are we going to talk about these other concerns I might have? Like, is there any worries about what dose of chemotherapy I might get based on my age? Is there anything I should know about my functioning after I get treatment, based on how healthy I am? And maybe even, hey, I heard about this new recommendation. Do you do this in this clinic before you would go somewhere to see if you're going to get assessed in this new way that's really the standard of care now?
Is there anything else that you'd like to add for our listeners? And then give us a website where we can learn more.
Sure. So the challenge now is to take these guidelines and put them into practice. So we really boiled down this assessment, this multidisciplinary assessment, to a practical set of tools that we're calling the Practical Geriatric Assessment, or the PGA. And that assessment really says, here's the key components, here's a specific tool that you can use, and here's the specific actions that you should take based on the evidence we have. So it makes them really practical and clinically focused, and then we've streamlined them, along with giving instructions or trainings that are available online. So pointing to a couple of sources, the Cancer and Aging Research Group, or CARG, has a website online called MyCARG, mycarg.org, based here at City of Hope. And you can go there, and there's a practical geriatric assessment there. There's our chemotoxicity tool there right on the front page. So that's a great place to start. The second place people can go is to the ASCO website. They have a specific website for patient-facing cancer and aging. It's based in the supportive care area. And you can go there, and it also has all this information and some links to the specific places you could go.
Well, Dr. Dale, thank you so much for joining us here on Health Professional Radio. Lots of great information. Hoping that you'll return and have another conversation with us.
Oh, thanks so much. It's been a pleasure to be here.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. William Dale. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.